I'd very much like to thank Maison Franco-Japonaise for hosting this talk, and to Adrienne, Sala for inviting me to present on what is still ongoing research relating to COVID-19. Oftentimes when we talk about research, we start with a lengthy justification of why we're studying what we do. And unfortunately, with COVID-19, I think its importance and the impact that it's left on the entire world is obvious. This is data that is looking at the cumulative number of confirmed COVID-19 deaths per million people as of May 19th. So far, we can see that the impact in terms of mortality and deaths has been extremely high in South America, North America, really the United States, as well as much of Europe, while, again, up to this point, most of Africa and Asia, including Japan, have been relatively spared. But this snapshot view also masks important differences in trends over time. This looks, instead of at the cumulative number, the daily confirmed COVID-19 deaths by world region. And we can see that the spikes are not distributed evenly around the world. Of course, the early spikes in winter and spring last year in 2020 were very much a European and North American phenomenon. But we see increases in cases in South America build up, even as Europe seemed to have clamped down on new mortalities as during the summer of 2020. The end of last year, fall and winter, was a horrible time, I think, for most of the Western world, particularly North America and Europe. And in the last few months, there's been a spike, a growth in COVID mortalities driven in Asia, predominantly from India, which, while on a cumulative count, is still low. Its daily rates are exceeding previous records elsewhere. We can also look, of course, by differences across countries. And this is where Japan and how Japan is placed in terms, or viewed in terms of its effectiveness in responding to COVID, varies depending on who your comparison group is. This again is cumulative confirmed COVID-19 deaths per million people. I've focused simply on Western nations, so Western Europe and the United States, and Japan and two neighbors, South Korea and Taiwan, two democratic neighbors. Compared to many Western advanced industrialized democracies, Japan has done remarkably well. This is something that I think makes Japan an interesting case for Western researchers to some extent. How did Japan achieve this low count? But of course, from a Japanese perspective, if we just look around our nearest neighbors in South Korea and Taiwan, the government response and the COVID scenario hasn't been as positive. We can see a similar thing if we look at it simply by confirmed COVID cases instead of mortalities. There are, of course, many different ways that one could study COVID-19 in Japan. There's the number, I think the number of papers that have been published on COVID-19 in general has exceeded 40,000, possibly 50,000 in the last year. And as I mentioned before, Japan has fared much better than the West, but worse than Asian neighbors. And I think when I speak to my colleagues in America and in Europe, what puzzles them is how Japan kept case counts and mortalities low, despite not enacting the very stringent and legally enforced citywide lockdowns and mandates to stay at home that other Western countries had to use, but were less effective. And this is important not just for COVID-19, but for thinking about how governments and societies should respond to future infections. Because these lockdowns and mandates have severe economic, social, physical, and mental health consequences, both short-term as well as long-term, if it's possible to get good outcomes without having to do it, that would be the best. Now, of course, that's not to say that the Japanese government hasn't done anything. The first major move happened in February 27th, 2020, when then Prime Minister Abe quite suddenly requested that schools be closed. Since then, there have been 3 state of emergencies. We are still in the middle of the 3rd state of emergency, at least in Tokyo. I think the expectation was that it would be lifted at the end of the month, but I think there are murmurs that this will continue for perhaps a few more weeks in June, particularly with the Olympics approaching. But most of the requirements made during these states of emergency were requests from the government, requests to not travel, requests to work from home, requests that restaurants close at 9 p.m., then 8 p.m., then don't serve alcohol. And of course, we see deviations from that, even just walking around Tokyo. There are social pressures to comply, but these aren't mandates, which is what makes the Japanese case interesting to study. And as I said, the ideal scenario, of course, is businesses comply and individuals comply through voluntarily behavioral changes. These include things like wearing face masks when you go outdoors, maintain physical distance from others, ventilate your workspaces, reduce unnecessary travel, and the like. And so what I want to talk about today is what can Japan teach us about motivations for individual and social adaptation? And the motivation part is what I want to focus on. Because broadly speaking, researchers have employed two different approaches or tools, methodologies to study COVID-19. One that is quite common among scientists, including and economists. Political science is a science too. So when I say science here, I mean physical sciences. The focus is on observed behavior. So let's look at people's movements using GPS data. Let's look at economic activity. Let's look at internet searches to see how behavior has changed. And this is drawn from a wonderful website called I don't know if it's RESAS or VRESAS. It's the big data division of the Cabinet Office in the government of Japan. And they show and track and in limited ways share data on things like population movements on the top left, point of sales data, how much economic activity is going, how many people have searched for restaurant information. That's fallen by 50% compared to the same time last year. How many advertisements are there for new job openings? It's a 12% decline from last year. That's on the bottom right, and so on. So this data is wonderful because one, it's real behavior. It's how people are changing what they're doing. But at the same time, it's hard to understand why people's behaviors have changed. We know where. To some extent, we know who, although privacy rules make it very difficult to track beyond basic demographics like perhaps gender or age group and region. What I'm involved with, and what our research group is involved with, is instead conducting social surveys. So we basically have been conducting a series of surveys through an online national panel where we ask people directly, not just about changes in their behavior, but also their political preferences and varying social cultural attitudes, which I'll introduce in a second. There are trade-offs to this as well, of course. One is it's expensive and cumbersome to do on a repeated scale. It's also hard to do beyond, let's say, about 5,000 to 7,000 people at a time. And even that makes it quite expensive. And oftentimes, when we're asking people about how their behavior has changed, we're relying on recollection. And recollection is not always accurate. But we think that there are benefits to taking the survey approach. And as I said, my research team has 6 other members, Susumu Kato, Takashi Ida, Kenji Shida, Ase Ito, Masahiro Shoji are all my colleagues at the Institute of Social Science. Hiroto Katsumata is at a different unit at the University of Tokyo. We have 2 political scientists, 3 economists, sociologists, legal experts. So we are addressing this question from a fairly wide perspective. So for example, one question, which I've referred to already, is how can we promote good behavior and outcomes without legal mandates? We have papers that look at social distancing, which I'll introduce in a few minutes. We have a new paper we're working on who adopts new technology. There's a contact tracing app called Cocoa that's widely used in Japan. And recently, people's willingness to vaccinate, how much value do they place on vaccination? We also look at a second dimension of the pandemic, which is sometimes called infodemics. The social media in particular has made it very easy to gather new information, but it's new information about a novel virus, which means that it's very difficult for people to assess what is accurate and what should be followed. And we look at differences by social network service usage. I'll show that data as well. And the third is how do citizens evaluate COVID policies, which I'll spend the latter half of my talk trending. So exactly what are we doing in our surveys? This data, this figure shows in the black line, moving average, so weekly average of positive PCR test cases nationally in Japan, going back to January 2020. Blue is the number of severe illness cases. So we can see, well, basically a huge spike that happens in winter, and much like a lot of Europe, as well as an ongoing spike in positive cases in the last month or so. What we've done is we've run 6 surveys that are divided up into 2 panels. What I mean by a panel here is a panel is where we are asking survey questions at different time points to the same people. So we're tracking the same people's preferences over time. And our first panel, we weren't sure how long this COVID situation was going to last. I suppose we should have been more pessimistic and run a bigger survey. We started with 2,808 people, surveys in March, April, June, and September of last year. The percentages in the brackets is the proportion of people who answered the first survey who stuck around to that panel. So what's actually wonderful about Japan is survey respondents are very majime, conscientious. So despite 4 survey waves, 2/3 of people stuck around till the end. We started a brand new panel with all new people in December last year, just last winter, 7,000 people. And we're probably going to preserve this panel over the next year or so, with particular attention paid to upcoming elections for the Tokyo municipal government, as well as the national election predicted in September or October. So what am I going to talk about today? So we measure a wide variety of outcomes and look at a diverse set of explanatory factors. What I'll spend the next 15 minutes or so talking about is research that we've already done and published, particularly like what kinds of people are more likely to take protective behavior. And I'll focus on social distancing, as well as a second paper that looks at people's beliefs about rumors and information relating to COVID-19. And we'll look at the effect of social network services as well as social capital. The second half, which is much less polished, and I'm hoping to get everybody's feedback on this if I can, is looking at the evaluation of policies and policymakers. The title of my talk, Who Do Japanese People Trust to Handle COVID-19 Policy, will be the topic of the second half of my presentation today. All right, so let's talk about the papers that we've already published that looks at variations in social distancing and belief in rumors. What's particularly tricky about COVID-19 is that the infectiousness is reasonably high, but it also has a large number of asymptomatic carriers. This is a situation where, well, one, so you can accidentally spread the virus to people without knowing it because you don't think you're sick. But it's also what we often call a collective action or free rider problem, which is you can get policies that are meant, you can ignore policies that are such as on social distancing and obtain the benefits if other people are following it, even if you are not. So, at a theoretical level, of course, any infection risk is conditional on your own behavior, how much you go out with other people, but it's also conditional on the behavior of others that you interact with, how much are they going out with other people. And what was suspected early on, and was certainly true with the early variants of COVID-19, is that there's very different rates of, first of all, becoming symptomatic and the severity of those symptoms by age as well as underlying condition. So oftentimes, the media would often criticize young people for going out. You guys aren't going to be sick, but you may make your parents sick, your coworkers sick. And so you should restrict your behavior. But of course, this is a free rider problem. It's that you're fine as long as other people are behaving correctly. And so those who have less concern or knowledge about COVID-19 and what should be done as protective behavior may undersupply that protective behavior. People aren't acting, They may be acting in their self-interest, but that's not in the social interest. So we've looked at what types of people engage in social distancing without legal sanctions, as is the case in Japan. We have one project that looks at different ways to assess risk aversion, how risk accepting are people. And that's an entire field in social psychology and economics of its own. What I'm going to show you now is the effect of it's a very broad concept called pro-sociality, is the extent to which you engage in behavior that is beneficial to the community or society around you. And we look at two items in particular: the extent to which people are altruistic and the extent to which people are sensitive to shame. So how do we do that? Well, we do that by simply asking the question. We actually have a large battery or large number of questions relating to social capital, people's personality traits, and so on. One question that we're calling altruism, we can call it something else if it feels a little bit off to you, is we ask people to whether they agree or disagree with a statement. It is important to help people around you and make them happy. Each color is a different response. So the black is no, and then it goes to a weak no. Green is neutral, pink is weak yes, and orange is yes. And what we see from the survey is at least a majority of people, 60% of Japanese people, claim that they're altruistic, or they think that it's quite important to help people. The second question relating to sensitivity to shame, it is important to always avoid doing anything people would say is wrong. I should note, of course, that these are translated from the Japanese original survey questionnaire. And here, fewer people are willing to say yes, although there are more people who answer yes to the statement than answer no. What we expect is people who are altruistic and sensitivity to shame may be more likely to engage in social distancing behavior. And that is what we find. So I'm going to be showing a lot of charts. I'm going to explain them as clearly as I think I can, but please feel free to ask questions through the Q&A function. So in the wave 2 of our first panel, so conducted in April and May 2020, so Golden Week last year, one question we asked is, how much did your frequency of dining out change compared to March? So compared to a month and a half ago. Answers were given on the 3-point scale. So dined out less is black, no change is blue, and dined out more is green. If we look at this figure, on the left, we see the differences in responses by people whose altruism score is high versus those whose altruism score is low. What the data shows us is among those with high altruism, 74.4% reduced how much they were going to dine out. Among those with low altruism is 59.2%. And this difference is statistically significant. So when your altruism is high, you're more likely to dine out less. And we see a similar pattern, but a bit weaker with shame. Those who have a high sensitivity to shame were more likely to reduce dining out. So the black box is larger than those who had low levels of shame. And we think it's a neat paper. This is a relatively short paper and one of the first papers that we published on this, because among other things, it suggests that understanding individual psychological and social factors are important. A different paper, and I noted that I was going to talk about this earlier, is about the bright and dark sides of social media usage. You know, I think we've heard a lot and perhaps too much about fake news, and there's, I think, the veracity of any information is increasingly at doubt, and rumors spread quite easily over social media platforms in particular. And many organizations, including the World Health Organization, has issued warnings about infodemics, which basically means there is too much information about COVID-19. It's also, again, a novel coronavirus, so people don't know who to turn to. And the quantity of information makes it harder to find accurate information or even judge whether or not it's accurate, particularly with the condition that what's considered true and untrue can change over time. That can produce harmful or suboptimal health behavior. And so in this paper, we look at social media usage Specifically, we ask about 10 different social media usages, but 3 that are particularly prominent in Japan: Twitter, Instagram, and Facebook. So we asked our respondents how much they use social media. We also, as comparison, I've listed how much people rely on traditional media to learn about COVID-19 or sorry, I think this is about political and social news generally. With regards to Twitter, the orange boxes are the daily count. So the proportion of people who use Twitter daily to gather news information. For Twitter, it's about 27%. For Facebook, it's about 15%, and for Instagram, it's 25%. If we include those who use it at least once a week, all platforms are about 40 to 50% or so usage. On the right is mass media usage, and here pink is people who use it daily. For print newspapers, about 20% of our sample reads newspapers daily. A slightly larger proportion reads newspapers online, it's web newspapers. And finally, TV news is the dominant market share. 70% of people get their news from TV. These are not mutually exclusive. Many people use multiple news sources. So of course, compared to mass media, certainly TV media, social media is less prominent, but it is roughly in line with newspapers. So we think it's an important avenue through which information is gathered. What we find in our paper, and I'll show you some data again in a second, is that, well, it's the title of the paper itself, Bright and Dark Sides. The good news is people are much more likely to follow government guidelines. They're less likely to dine out, less likely to have face-to-face conversations, and they're more likely to buy disinfectants. They're also more likely to do things that are not recommended by the government. This includes things like buying more video games, buying more books, as well as buying more natto, fermented soybeans. I mean, games have nothing to do with COVID-19. Natto, there is a rumor that's still persisting that prefectures that ate more natto had fewer COVID cases, and so natto must be good. Now, of course, this information or this kind of behavior isn't bad. Like reading more books isn't bad. I personally think, playing more video games is also not bad, and eating natto is good for you in general. But there are risks that social media spreads information that is worse for your behavior, not just indifferent. And one thing we discuss in the manuscript is ways in which the government should selectively counteract false information. It's hard to negate all false information, but it is probably very important to counteract unhealthy or misaligned false information. And this is what the data looks like. I'm going to show you this chart because a lot of my charts are going to start looking like this. So the left is what we're actually measuring in the paper. It's changes in behavior from January to March 2020. How many people said they were going to engage in less face-to-face conversation, less dining out, buying face masks, disinfectant, toilet paper, which you might remember was in short supply for a minute, as well as buying more natto. And in general, January 2020, there was minimal concern about COVID in Japan. By March 2020, it was a more serious issue. Many people said less face-to-face, less dining out, only a 9% increase in want to buy natto, which I can't tell is low, or perhaps it would be even more disturbing if that was higher. So we run statistical models, regression models. And what we do is we separate respondents into heavy SNS users and light SNS users. And we look at the difference in their behavior based on SNS usage. So this type of plot on the right is sometimes called an airplane plot. So what the circle shows is more or less the predicted difference or the difference between heavy and light SNS users as percentage points. So heavy SNS users were 0.044 means 4.4%, 4.4% more likely to reduce face-to-face conversations. And the lines that you see on the ends are confidence intervals. You can think about them as margins of error. For reducing dining out, SNS users were 6.2% more likely, natto 4.1% more likely. Toilet paper is not statistically significant. When the confidence interval or the margin of error overlaps with the 0 line, it suggests that it's not statistically significant. But again, across indicators, we see differences by social media usage. So that's the stuff that we've worked on already. What I want to spend the rest of my talking about is stuff that we're working on now. And that relates to evaluations of COVID-19 policies enacted by not just the national government, but local governments, and how citizens or our survey respondents evaluate government performance. So, Japan has done better or worse depending on your frame of reference to other countries, but there's of course regional variation within Japan. You may recall this picture if you live in Tokyo. These were the Tokyo alert signs. They were going to light up, I think it was Rainbow Bridge, and the Tokyo Metropolitan Government Office in red. And I was going back to find out what the line was, and they were going to light it up in red when basically there were more than 20 cases, which feels so naive and innocent, I should say. And it's been horrible that things have become much worse. I don't think they really do the Tokyo alert anymore, but it received a lot of attention at the time. So one, prefectures have their own policies that they do. The second is that there are national policies whose effects vary across regions. So this is a go-to travel policy, which the government enacted last year to encourage people to travel first within their own prefecture, but then to other prefectures. The government would subsidize costs of transportation and hotel accommodation. Prefectures actually varied in when they started signing up for this, and the extent to which this plan encouraged increasing tourism also varied across regions. So variation in policy uptake as well as effects. And a lot of this we're still looking at, and I won't be able to give you good answers about. But we also know that there's variation in COVID trends. So these are the 6 largest prefectures in terms of population, or 6 of the largest, and I have Hokkaido in there as well. This is the positive PCR tests per million residents. So it's standardized by population. And to a large extent, the patterns are similar across regions, although the degree of the spike varies. So Tokyo had a massive spike earlier this year, while Osaka is having its big spike right now. Aichi has clearer spikes. When it goes up, it goes up. When it goes down, it goes down. But Aichi, much like Fukuoka, is going through a high case count at the moment. But not all prefectures have been hit hard by COVID. This is in somewhat less populated areas, although some of them are adjacent to metropolitan centers. So Nara has a huge spike going on now. This is probably a broader pattern within Kansai. Okayama is another one, but Iwate, Fukui, Kochi, Tottori prefectures, they have had spikes, but even on a per capita basis, they have not been as affected by COVID-19. And we're looking at how, for example, it's one of my co-authors is from Tottori, and he claims that people from Tottori are more altruistic. We haven't been able to verify that with our data quite yet, but we do expect social attitudes and individual behavior to vary across prefectures. But a key thing that we're looking at, particularly with an eye towards upcoming elections in Japan, is what psychologists, social psychologists, political scientists call motivated reasoning based on partisanship. So motivated reasoning is, simply put, a case where you ignore information that you don't like and only listen to information that you like. And what we're looking at, what our team is looking at, is how that's conditional on which political party you support. So for example, are LDP supporters more likely to listen to advice coming from LDP figures, including the prime minister, than they are from opposition figures? At the same time, are they more likely to ignore information about scandals or criticism or ineffectiveness of government policies than they are to listen to good information? And the backdrop of motivated reasoning is complex, and frankly put, I'm not going to be able to analyze or discuss it fully today. But a naive sense of, or a simple way of thinking about partisanship is voters like parties who promote policies that they agree with and share similar values, right? So if you're very progressive or liberal, maybe you like the Japan Communist Party. If you're more conservative, you may prefer the Liberal Democratic Party. And if the party's policies change, then you'll switch which party you support. The idea is that you are stable, the parties change, and so you choose from different options on the menu. The second is more that the parties themselves may not change that much, but you as a voter change what you like and dislike. And there's a lot of research, particularly in Europe and America, and to some extent in Japan, that voters have emotional, psychological attachments to political parties. It's like supporting your favorite sports team or celebrity or actor. And this causes pause in how we think about politics, because if political elites politicize an issue, meaning they make it a big deal and they say, we're going to fight this, we're going to fight the next election on this, then it'll probably move voter preferences as well. So if your preferred party says, COVID is fine, we don't need to socially distance, then you as a voter, even if you disagree with it before, may also adopt that preference. So this is a broader context that we want to examine. And so let me start showing you some even more data. So I'll be matching or mixing data from different panels and survey waves. Here's data on the left from our May 2020 survey, on the right from our March 2021 survey, so from 2 months ago. We asked respondents to grade on a 5-point scale, where 5 means good job, 1 means terrible job, how they evaluate the COVID responses of the Prime Minister, the governor of their prefecture, doctors or ideologist medical personnel in general, the mass media, and government experts. What we find in general is that across the board, scores are lower on the right in March this year than it was on May last year, although the difference is not that big. What's more striking is that the patterns are more or less the same. The Prime Minister and mass media score poorly. Governors score better, although there actually is a lot of variation by prefecture. Medical personnel are viewed positively, while government experts are actually not doing all that well. I suspect we'll see similar patterns in other countries, particularly the high evaluation of medical personnel. So this has a lot of text, and I'm not going to talk about it all. But one way of thinking about partisanship is, of course, depending on which political party you support, the glass may look half full or half empty. This figure combines 2 kinds of data. On the right, we have respondents who said that they're supporters of the Liberal Democratic Party, so the current governing party. On the left are those who do not support the Liberal Democratic Party, so anybody else. What I've done is, for each prefecture, I've taken the average difference in the evaluation of the Prime Minister versus their governor. What that means is if the bar is to the right of 0, so it has a positive value, it means that on average in that prefecture, people value the Prime Minister more highly than the governor. On the left, negative means people value the governor more than the Prime Minister. So one obvious difference, which is not surprising, is among LDP supporters, the right panel, the split between evaluating the Prime Minister positively or the governor more positively is about even. There's a range of prefectures such as Nara, Oita, Nagasaki, where people evaluate the Prime Minister more highly. There are places like Hokkaido and Gunma where people evaluate the governor. But it's roughly evenly split on which side of the coin they fall on, and Tokyo is here. May 2020, people, including LDP supporters, even among LDP supporters, people evaluated Governor Koike more than Prime Minister Abe at the time. Among non-LDP supporters, everything shifts to the left. There's only 2 prefectures, Nara and Ishikawa, where people evaluate the Prime Minister more highly. I've talked to friends in Nara, and the current governor seems to be relatively unpopular, which may be contributing to it. So I'm going to show you the same chart, but tracked over time. So next we have September of 2020. The individual prefectures, of course, move. So Tokyo is still negative for non-LDP supporters, but actually among LDP supporters, finally, even among, well, not even among LDP supporters, people view Prime Minister Suga at the time now more highly than, actually no, we ran the survey before the government change. So this is still Prime Minister Abe more highly. But what I want you to focus on is the overall shift. Right? So in May 2020, opinion among non-LDP is uniformly negative, among LDP is split. By September, things have moved to the right. Among LDP supporters, more evaluate the Prime Minister more highly. And among non-LDP supporters, we see more prefectures that value the Prime Minister more highly. What this shows is, basically between these two time periods, either the Prime Minister looks better or their governor looks worse. And we have different theories and different ways of testing it. And I'll show you once more. This is March 2021. Everything has shifted back to the left, right? More people are valuing the governor more highly than the Prime Minister. The movement in Tokyo is actually quite small. It suggests that public opinion in Tokyo is close on how they're valuing the Prime Minister and the governor. Among non-LDP supporters, it's quite less. And Tokyo has fewer LDP supporters than many other prefectures, for that matter. So from an evaluation perspective, it went from bad for the Prime Minister, or kind of bad for the Prime Minister, to better for the Prime Minister, to now pretty bad for the Prime Minister. We also look at the effect of partisanship and other factors on a range of other questions. So for example, we asked people, do you think that the COVID-19 situation will be better 6 months hence? And we asked this question in May 2020 and in September 2020. So on the left, we have a histogram that plots the distribution of the data. People who answered 5 said it'll be much better. People who answered 1 said it'll be much worse, and 3 is neutral. What we have in blue is the distribution of responses in May 2020. So in May 2020, a majority of people answered 4 or 5. So they thought it was going to be better. By September 2020, the distribution has shifted to the left. There are more, or many people are still positive, but they're much less positive than they were in May. We can also run statistical models that look at which types of people were more likely to think that COVID would improve. So, there's a lot of demographic differences that are quite fascinating that I won't get into today. For example, gender, whether you went to university, you're in full-time work, you live with your parent, you live with a school-aged child, you live with a child under 6, and whether or not you live in the greater metropolitan Tokyo area or Stockholm. But what I want to draw your attention to is in almost every question that we ask about expectations about COVID and policy, demographics make small differences, but which party you like has the strongest effect. So for example, for this LDP, what this is comparing is how much more likely, so positive means you think things are going to be better on a 5-point scale. What is the difference between an LDP supporter relative to an independent, meaning somebody who says they don't like any political party? For the LDP, we see a 0.34 increase in the score on a 5-point scale. Among left-wing supporters, left-wing party supporters, it's negative, but not statistically different from independents. So what this graph suggests is that LDP partisans are more optimistic about COVID-19. Another question that we ask is, which do you think is most important in guiding public policy? Of what's best for public health or for restoring economic activity and growth? So here we asked this question on a 11-point scale from 0 to 10. So if you answered 0, it was you have to value public health the most. 10 is the economy is of paramount importance. So again, in blue, and you can see the blue shaded under the red, in May 2020, public opinion was very much on public health. This is when the lockdown was still going on last year. So of course, the sentiment is heightened. But by September, by fall of last year, the opinion is actually almost evenly divided, as many people think you should value the economy as public health. So we see the distribution shifting to the right. We can run a model again, who's more likely to value the economy over public health? So positive score means people value the economy more. If you recall in the last question, we asked, do you think the COVID situation will improve? Unsurprisingly, if you think COVID will become better, then you prioritize the economy more. But it's also true for LDP supporters. There's a positive movement. So LDP supporters are more likely to value the economy than independents are, while left-wing supporters are less likely to view the same. I'll note a couple of other points. One is women are much less likely to value the economy. I shouldn't say much less, they're less likely to value the economy. They care more about public health. This is consistent with a lot of research about the trade-offs on policy priority that exists between gender. We also see that people who live with young children want more focus on public health and the economy. Lots of possible reasons. Well, they have a young child. Even if young children are asymptomatic, if they become sick, then they can't go to work. Or if their school, or if a classmate becomes sick, then the school may shut down, and then that affects their employment as well. We asked a slightly different question in March of this year. Instead of asking about public health versus the economy, we asked which is more important, restricting individual activities in the aim of public health, or preserving individual freedom as much as possible. So this is a more philosophical question about what should guide policy. What we see with the data again is more people are on the left end of the spectrum. More people think public health is more important and are more willing to support restrictions on individual freedoms. But what's fascinating and was counterintuitive in this study is when we run a statistical model, we don't actually see big differences by partisanship. Both LDP and left-wing party supporters are more likely to favor individual freedom, but it's not statistically significantly different. Instead, we have massive differences by demographics, particularly age groups. So again, keeping in mind, a negative score means you value health more than the economy. Women, much like the last survey, value health more. Sorry, not economy, over individual freedom. But compared to people in their 20s, every age decile is increasingly less likely to value freedom, meaning more likely to value public health. This is probably related to health risks to some concern. We also get some differences by your family profile, but on this philosophical question, freedom or public health, it's not so much a divide between by parties, but rather a difference by generation. I think this is a couple of last slides. I showed you earlier about who wants to buy more things, like buy more natto. A question that we've also asked is, what kind of rumors have you heard, and do you believe it or not? And 3 that we picked up here is one, that natto is good for you. It'll help stave off infections. Another, which was big news last summer, was whether or not this drug Avigan, which had been promoted by Prime Minister Abe, was effective in minimizing the severity of symptoms. It turns out that there's no scientific confirmation of the proof, so it's now not being used for that purpose. And the third, which we're still exploring in current surveys, is whether people think COVID was a man-made virus. So this chart, again, is a little bit complex to see. I'm just going to draw your attention to some. So again, each marker and the number shows the difference between a supporter of a particular party, like LDP, Ishin, the Japan Innovation Party, and left-wing political parties collectively. So what we see is LDP supporters were 8.5% more likely to believe that Avigan was effective in May of 2020. This is before there'd been a lot of evidence about that fact. They're also more likely to believe it in September, when evidence seemed to be weaker that Avigan was effective. They're 9.3% more likely to believe it. Ishin supporters are quite interesting. They're much less likely to believe that natto is effective. We have two co-authors from the Kansai region in Osaka, and they claim it's because Kansai people don't eat natto to begin with, so they refuse to believe that this could be true. But Ishin supporters also believe in Avigan, that persists still today. The only group that is less likely to believe that it's a man-made virus compared to independents is left-wing party supporters. They're 16% less likely to believe it. So, partisanship affects, again, a wide variety of attributes. And I think the last thing I'll show you is beliefs about the Olympics. In our March 2021 survey, we asked people, what do you think should be done about the Olympics? And our results are consistent with what other surveys have found. If anything, more recent surveys, I think, have found more people in favor of canceling the Olympics. But to show you some interesting patterns, there's actually very little difference between respondents who live in Tokyo and those who live elsewhere. If we divide this by Shotoken, the greater Tokyo area, the pattern is the same. Just under a majority are in favor of canceling the Olympics. Postpone is about 17%. Hold on the current schedule, but with 0 fans. Hold, but permit Japanese fans. And hold fully. So, basically nobody wants to hold it fully with no restrictions. But the only one where there's a strong, a clear group that clumps on one response is cancellation. And that's true Tokyo and elsewhere. But there is a difference by, again, partisanship. At the bottom, we have those who say they're LDP supporters, and at the top, we have those who say they're not LDP supporters. Among not LDP supporters, 52% want to cancel the Olympics. Among LDP supporters, it's about 1/3, 34.8%. LDP supporters are more in favor of postponing or doing any other measure, but cancellation is something that they're against. So what I'd like to leave you with is, I know I've showed you a lot of patterns, and I'm more than happy to go back and revisit any, and I have some others that I can show if questions arises, is there are a lot of things that affect how people respond and engage in different kinds of behavior under COVID-19. As I began the talk with, Japan is a success case from a global perspective, much less so perhaps from an East Asian perspective. But mortality rates, infection rates have been lower. And they were able to achieve this without legally enforced restrictions on a variety of individual and social behaviors. Everything has to be with a caveat, because we don't know what the situation will look like in a month or two. So what looks good now may be less good when we look back in the future. But what I'm interested in, what our group is interested in, is what causes individual level variation and how that produces regional variation as well. We've studied how things like altruism to sensitivity to shame can affect social distancing, how social media increases the range of behaviors that people do, regardless of whether or not it's been scientifically confirmed. And the second half of my presentation was on partisanship and how partisanship colors a lot of things related to COVID-19. We knew this to be true in America, certainly, and in most of Europe. But we find evidence of this to be true in Japan as well, where partisanship has generally been thought to be weaker, although new research suggests that Japan is becoming more like the West, for better or for worse. We've been working with different organizations on how our evidence points to the importance of catering different messages or policies to different subpopulations, right? So things that work on social media users may not work on non-users. I mean, that's fairly obvious. Where do you do your advertisements, Facebook or on television? But altruism and sensitivity to shame also matter. So if altruistic people are already more likely to do something, then what are messages that will help people who are not altruistic, right? So it's maybe appealing not just to the social benefits of an action, but really individual benefits to an action, maybe more important to reach these target groups.